Well, so we have to look at the subject of fistula, and we know, Marvi, we have a new documentary.
Yeah, we do. We do have a new documentary, but we have a whole new conversation to have this week as well, because this whole week is dedicated, and we have to have conversations around this. I think it's 23rd. That's the UN Day. That is to observe, yes, this fistula condition exactly. But Justice Beidou has put together this documentary. I want us to watch, and then we'll come back and have a lot more conversations around it. And more than 13,000 victims of obstetric fistula, a birth-related injury that afflicts women who have suffered obstruction in labor, waiting surgeries to correct their condition. The subject is the focus of JoyNews' newest documentary, Leaking Wounds. In the following report, my colleague Justice Beidou brings us a sneak peek of what to expect in the 30 minutes film.
Inside the local hospital in Boko, a cesarean session on a woman in desperate need. This hospital is located in one of the poorest parts of Ghana. It goes to show how far healthcare delivery here has come. Dr. Clement Opon, an example of a dedicated health workforce offering his expertise where many his like would hardly go. Here he performs more than 3 surgeries every day.
So Upper East has a high population of teenage pregnancies. Okay, I think somewhere in the other parts of the country, teenage pregnancy is seen like a child who has gone to do something. But here, these are married, wedded young girls who require babies. Okay, in my consulting room, I treat patients who are as young as 17, 18, and are still treating infertility, looking for babies. And once these patients are very young and they are carrying babies, labor and delivery is likely to be difficult.
This region already has one of the worst records of maternal mortality. And for some of the women lucky to deliver alive, complications like obstetric fistula occur. Fistula is a childbirth injury which occurs when labor is obstructed and the woman fails to reach emergency care in time.
The patient will be presenting with continuous leakage of urine through their birth canal, through the vagina. As you sit down now, you will be leaking urine continuously, 24 hours, 7 days a week. Morning, afternoon, night, your bed is wet, you never will be dry.
At the OPD, some of the women who live with the horrors of fistula have come for their routine checkup. Most of them married off at tender ages. Hawa Halidu, married at 13. Zainabu Abdullahi, married at 14. Shehu Lar, married at 15. The list goes on and on. They are comforted by Cynthia Sinawisi, herself a fistula survivor, helping other victims to come out.
I lived with it for 2 years, 2 months.
Tell me how it was like for you.
It was like hell. You can't go anywhere, you can't mix, you can't be with your friends, and a whole lot. The only thing you can do is to be in the house. There are times when you even go to fetch water in the borehole and people are there. Because of the urine scent, they will start moving one by one.
13,000. That's the number of women who currently live with fistula in Ghana. It's a condition that requires huge amounts of money to repair. And yet, Ghana's health insurance, a scheme that is already overstretched, does not pay for its repairs. And in areas like this where poverty levels are high, victims of fistula are left to their fate, living a life of exclusion and loneliness.
Cynthia has brought us to the outskirts of Garu, some 1-hour drive from Boko, to meet someone who has been living with fistula. We've come here to meet Mampuak Yaro. She's been living with fistula for more than 20 years. Mampuak's mother betrothed her to a man that she herself had refused marriage to. The man already had 8 wives. She's not sure what age she was then, but she says she had just developed breasts then, possibly meaning she would then have been in her early teens. She had her first 4 deliveries unsupervised at home. It was her faith that got complicated. When she couldn't reach a professional birth attendant after 24 hours in labor, she lost her child and had to end up with fistula.
I was in labor for 2 days and I had to struggle to give birth on my own. In this town, if you go into labor and you're not able to deliver on your own at home, they say you are not woman enough.
So what happens to a lot of the women who are living with fistula in this community?
No one helps you, so I only farm to eat.
The story of fistula victims goes to show how healthcare delivery in Ghana marginalizes the poor and most vulnerable. A backlog of at least 13,000 women are waiting that some way, somehow, help would reach them to have their own surgeries soon. How long they would have to wait, nobody knows. Justice Beidou, Joy News, Boko.
All right, so this is the Revelation and Justice's documentary. But as you know, he always goes through a lot to arrive at what he brings us when he puts together these documentaries. So let's talk to Justice. Let's find out why he focused his attention on this particular documentary. Justice joins us via Skype. Justice Beidou, good morning to you. I hope you're well.
Good morning, Mavi. I'm well. Hope you're well too.
This is not one of the documentaries that you do that will make me smile. This is sad, really. But why did you focus your attention on fistula?
So we've been doing a lot of work on JoyNews on maternal health. That has usually speaking about women dying at birth and then going through a lot of difficulties to reach health centers when they need them whilst pregnant. So in doing all of these work, one of the things that I came across was a condition called obstetric fistula. As you imagine, it's a condition that very little is known about, because it affects the most vulnerable people, poor women, women who are not really spoken about, and because of the way the condition is, are kept away from the mainstream of things in terms of the communities where they live. And so I came across it and then asked a lot more about it, and I was shocked to know that such a condition that affects women and makes their life really a terrible one, because then you are not able to control your urine or your feces, and it's only because you decided to give birth. So yeah, that is the focus of this documentary. It's shot in 3 different regions: the Upper East region and the Upper West region, and then we also shot it the Greater Accra region. And it highlights really the big problem that is in our maternal health delivery system as it stands now.
But Justice, this condition is treatable. You also touch on the fact that it's not covered under the NHIS. Tell us more. Tell us more, Justice. Okay, we're going to be touching base with Justice in a bit. He's joining us via Skype. We're talking about some of the revelations in this documentary that he's put together. But we're also speaking to Dr. Clement Opong, who's a medical director in charge of the Presby District Hospital in Boko. And Boko is in the Upper East region. If you look at the areas where this condition prevails, it actually prevails in all 10 regions, but the northern region has the highest prevalence, followed by the Ashanti, the Western Central, and the Upper region. So it's appropriate that we speak to Dr. Clement Opong, who is featured in this documentary as well. Doc, good morning to you. Thanks for your time.
Yeah, good morning. Thanks for having me.
Sure, we're grateful. So what kind of patients do you meet?
As you said, fistula patients are usually vulnerable, young, poor, illiterate, rural women who go through difficult delivery. That usually suffer from this fistula. Usually we prefer to call them fistula survivors because when you go through this difficult delivery, some of them unfortunately lose their lives, but those who survive are the ones who come to hospital with this condition. So normally the people we meet are very young, illiterate, and from very deprived backgrounds.
So, Doc, we're told, but this condition is treatable, correct?
Yes, it is treatable.
Okay, so how?
It is treatable.
But there are challenges.
Yeah, there are challenges because one thing that we face in the hospital where we have fistula treatment services is that, fistula patients are not patients who wake up in the morning, dress up, and then come to hospital because of the stigma attached to the condition. There are people who are often debilitated, they are very poor, they lost their livelihood because they are smelling, they can't go to the mosque, they can't go to church, they can't go to the market. Families have usually abandoned them, and always these people are not, through the healthcare system usually are not aware of them. They are always hiding. So before you can have access to fistula patients, there have to be an active case search. People have to go to the community, look for them, mobilize them, and bring them to the hospital. Even if they decide to come to the hospital, even joining public transport to come to hospital is a problem. So these people are always neglected and isolated. So if we sit in the hospital, even with the best fistula surgeons, it is difficult to have access to these patients when where we are supposed to get them for treatment. Again, the cost of treatment is also very high, even though we are having support from NGOs like UNFPA and other things to support us with the fistula surgery. Usually the cost of treatment, especially when they come to hospital, they are feeding, and usually are supposed to stay for a very long time before they leave. The cost of treatment is always prohibitive, and that is what is hampering the fistula treatment in the hospital.
So, Doc, is the condition such that you can't control yourself at all? You can't control your urine at all?
Yes, that is the condition. Normally, when a woman or a young woman goes through very difficult delivery, for a very long time, a lot of our women, even though our antenatal attendance is very high, most of our women prefer to deliver outside the hospital for a reason I don't know. So when the delivery is very difficult, you lose the baby. After a while, then this condition sets in where you start losing urine, and sometimes that's what we call the vesico-vaginal fistula, where the urine leaks through the vagina. Or sometimes you have a recto-vaginal fistula, where actually the feces actually leaks through the vagina uncontrollably. So, I mean, it's a very, very serious condition where there is a lot of infection leading to infertility and even affecting their sexual life. Families,
Yeah, I was just going to ask, do you know if some of the patients, before they even come to you or to the hospital, do they try to treat themselves with something else or by another means?
There are a lot of herbal preparations that people claim they can apply to cure. So some of these things cause more harm than good. As I'm saying, there are a lot of concoctions that even lead to more infections affecting their fertility and their sexual life. And that, because they don't even have access to the hospital in the first place, encourages them to use these alternative means of treating themselves. And they get to the hospital in a very, very bad condition, sometimes with infection and sepsis that need to be treated to save their life before we can even prepare them to do surgery for them.
I was reading some findings, and in Mali, it cost about $70 to treat this condition. Do we know how much it costs to treat in Ghana?
Yeah, I'm not sure, but I think I've seen some statistics that say that about $30 or so. We need about $30 or $300. I'm not very sure to treat one fistula case. But that's what I'm saying. There's a lot of support from NGOs who provided with the sutures, the infusions, and a whole lot of things. But it goes beyond that. Treating a fistula patient goes beyond just closing the hole and making the patient continent. As I said, these are people who have gone through a lot of physical and psychological trauma. After even closing the fistula, how to treat them and then reintegrate them into the community is a problem because they've lost their livelihood. And even with the closure of the fistula, there's so more to be done in order to maintain a psychological balance that they've lost for a long time.
But are these women who can, get pregnant and deliver babies again?
Yes, it depends on the stage of the condition. When the fistula is repaired in a very early stage, or maybe the case is not very advanced, it is possible. Some of them regain their reproductive health, and only that when you get pregnant again, you have to undergo cesarean section to deliver the baby. So it is not a contraindication for having pregnancies after fistula, no.
Do you record a lot of successful cases at the Presby District Hospital?
Yes, we have done a lot of successful cases. Usually, we have surgeons coming from Kolebu, Dr. Karim and Dr. Ali Samba and Co, who come here for fistula camp. And we've done a lot of them. We started treating fistula cases since 2015. We did a camp, about 2 camps in 2016, and then we did another camp in 2016. In 2017, we have not done any camp. We are still waiting because usually the funds are relayed through the Municipal Health Directorate, and they plan the activities maybe in the first quarter or the second quarter or the third quarter. So as and when the activities are planned, then we work with them and mobilize the patient for the repairs.
So finally, Doc, without the donor supports, does it mean that our own insurance scheme does not cover the treatment of fistula?
Yeah, there is a component that the insurance pays. In fact, if you look at the insurance price list, there is fistula repair on it. But looking at the state of our insurance now, I think we don't have to even talk about it because the insurance is virtually non-existent anywhere. I mean, I think that I don't have to speak about it on air, but that's the reality on the ground. So if you want to use the insurance as the basis for treating fistula cases, I don't think it will ever be done. The tariff or the insurance is unrealistic, and again, it is not also being paid. So that is the state of the insurance. But the insurance has a component on the price list for treating fistula cases, and that must be admitted.
Dr. Clement Opon, we're grateful for your time this morning. That's the medical director in charge of the Presby District Hospital in Boko, sharing a lot more on this condition with us and an experience also at the Presby District Hospital. But Justice is joining us again, this time via phone. Justice Baidu is the gentleman who put this documentary together. That is later this evening. Justice, correct? Hello, Justice? Justice Baidu, we're airing this documentary this evening.
So this was tonight at 6:50.
Well, apologies. The line connection there to Justice Baidu is rather bad. We're going to re-establish contact with him again, Roland.
And we know that Justice put together this documentary based on what the persistent calls have been about the concerns of fistula. And personally, I'd been involved in a case involving a lady somewhere in the central region, and I had to get some treatment at a hospital just after Mankasim thereabout. Ultimately got a treatment that she needed, and now is free of the problems or the difficulties with fistula. But it's a problem that confronts many women around the world, and we know that across the world there are thousands, if not hundreds of thousands of people who suffer fistula. And as a result of that, would have to be given some level of treatment, most often through surgery. And for many of the times, it is something or a phenomenon which we know that many public health institutions also tend to grapple with. Again, we have to just apprise ourselves of what fistula is, and it's an obstetric hole between the vagina and the rectum or bladder that is caused by prolonged obstructed labor, leaving a woman incontinent of urine or feces or both. And for women with obstructed labor that goes unattended, the labor can last up to over 6 to 7 days. That happens prior to to giving birth, I should say. And it's very uncomfortable for many women. They feel so much shame within the period. But saying that, I have to say you're a senior pharmacist with the district hospital in Boko. And good morning to you, pharmacist Salifu Combat. And thanks for the guinea fowl. I enjoyed it.
Is this the same facility where Dr. Clement Upon works?
I think so. Yes.
Okay, but you are talking about fistula, and I've just been reading. It says that it has been virtually eliminated. Roland, listen to this, in Northern America and in Europe. But here, particularly in Sub-Saharan Africa, we hear the numbers are still increasing, and that includes Ghana. Nearly 50% of all obstetric fistula patients are between the ages of 10 and 19. And most of the babies that are born out of this are usually stillbirth.
Wow.
Yeah.
Wow.
It's interesting. And I think what is also touching is the fact that the doctor was talking about, even after treatments, these women have to go through a lot to get them back into the society, because they go through a lot of isolation, if you like. And even when they've been treated, people still don't want to come around them. So a lot more psychological issues that they go through as well. It will be good to sit back and watch the full documentary that is this evening at 6:30. Is Leaking Wounds, and that's been put together by Justice Baidu, who we lost on the phone and on Skype as well, but that documentary would air today.
And I should say that apart from pharmacist Salifu Combat, who also help in improving the situation in Boko, we also have Dr. Francis Asana. He's the CEO of the Quality Group of Companies. A medical doctor himself has established a hospital there, and they also help in improving the health of many people in Boko and its surrounding areas. We also have to say...
Well, what did he also give you?
No, they all help in a lot of things. So, good morning to you.
Yeah. But we'll spend time on this subject later this week as well, because as you know, the 23rd of May is a day that's been set aside to have these conversations.